Welcome, my dear listeners. Welcome to another episode of Redoctoring, your permission to be a different kind of doctor. Today, I have with us Dr. Busi. She is the Innovation Director at DG Murray Trust. She's had quite an interesting journey with figuring out her career trajectory. And I'm excited for us to glean a bit of wisdom from her journey and to see what can apply to our own. Busi, how are you doing?
I'm good. I'm good. Thank you so much for having me. How are you doing?
Thank you so much for being here. I'm also doing well. I'm doing well. Let's see, to start off the conversation, can you tell us how has being a doctor changed from how you started initially coming into medical
Mhm.
school versus where you're at now?
Sure. So I went to medical school in Cape Town, and I think I went with very kind of traditional goals that, I was going to graduate and find my specialty. Um, but yeah, my journey's been a little bit different than I think the traditional path. So after graduating, I did my internship at Tambo Memorial Hospital in Boksburg. And then I did my community service with the city of Johannesburg. So I was moving around to different facilities in Soweto, in Joburg, Central, Sandton, all over the city. But also during that time, which was sort of the transition between internship and community service, it was COVID-19. So the height. And I think a lot of doctors that were working at that time, a lot of us were sort of pushed into emergency side. A lot of the wards were converted into COVID wards. And so we were really on the front line. And I think that was kind of like the final decider for me because I really got the sense of how broken our health system is. And I guess in the face of a disaster that COVID was, it highlighted it for me. But I think even before that point, I kind of knew that I had interests outside of sort of the traditional clinical path. I remember getting to med school and I was like, it's great, but I didn't really feel like, these were my people. And then around fourth year, we had a public health course or module, and they were these funky people who had traveled the world and had done interesting things and were sort of researching things that were based off of things they're curious about, not just being like, oh, can I find a connection between TB and something that is country related? And I remember feeling even at that point like, oh my gosh, these are my people and this is the kind of life I want to embody. And so fast forward to ComServe, COVID was really tough. I was working in emergency rooms. And yeah, I think it was clear for me that once I've completed my ComServe, if I find an opportunity, whatever it looks like, I'm going to take it and I'm going to begin to craft a path. And so I think I was unemployed for like 2 to 3 months post community service. And then, yeah, in one of the WhatsApp groups, somebody shared this opportunity with this organization called the Douglas Murray Trust. And at the time, they were supporting the Department of Health with the vaccination center, set up a campaign, to educate people around vaccines because there were a lot of myths and people were hesitant at the time. And yeah, and they were looking for young doctors. And I jumped in and I didn't really know what the role was going to look like, or what skills were required. But I think I was enthusiastic to learn and I did. And so, yeah, now I'm in public health, which is a very broad concept, which I think I like because I'm able to then find the things that align with me and do that work. Yeah.
Alignment is so important. I'm really learning more about it right now in my life. But let's talk about medical school, where you started already feeling the disconnect. Do you remember which year it was in? Do you remember anything that was causing the disconnect?
Sure. So I think, first of all, like I'm from the Free State, Bloemfontein. And so moving to Cape Town when I was 19 was, I think, a shock to my system on its own. Like everything was bigger, faster. And I also remember thinking to myself, like, oh, this is like UCT med school, like the smartest people are here. And so I did have some insecurities, some imposter syndrome, but I was able to find my feet and do the work. And yeah, it was a tough, I think just a tough transition period. But then I think as I went through med school, you're growing up and you're like, "Hey, who am I? Like, what do I like? What do I find interesting?" And I was like, I mean, biochemistry and physics and, anatomy were great. And I am curious about science and the human body. But I was like, I don't know if this is like forever. But I think I enjoyed it enough to continue. And I think maybe it got better for me when we got to the clinical years because I enjoy interacting with patients. I enjoy, bringing the relief or the remedy or the management to people. And I think that's the heart of why I decided to study medicine is about people and figuring out how to, make their lived experiences better.
It's quite interesting how people stay in medical school and the whys that literally carry them. For you, it was initially
Yeah.
the interest that you had, and then it translated into how that applied to people. And I think it's even quite powerful to see how it's now even applied into what you're doing in public health, because you're very people focused in public health. It's for the public.
I just wanted to add that I think the reason why I like public health is it thinks about prevention as well. So it thinks about the human before they get sick and like what are the factors that can make people sick, but also it takes a bigger lens just in terms of like beyond a single patient or 30 patients that you see a day. Like you think about towns and cities and districts and like how do we make people healthier now? And there's also a long-term view, like in the next 5 years, how do populations get better or more sick or in 10 years? Um, yeah, and I enjoy that about public health.
Did you ever feel guilty about leaving like the clinical route that, everybody thinks that a doctor should be on?
I definitely did. I think it's not an easy decision because I do think, especially because we spend so much time and money and in medical school, it is difficult to pivot because number one, the destination is less clear. I think number one, and you worry that like, was this all just a waste? Am I throwing this away? But I think what I've learned is that this path or whatever path you choose is still finding your own lane, your own specialty and growing your knowledge and becoming a voice. And that's exactly what specializing is. And I think because I've invested in continued growth, I don't feel regret about leaving clinical medicine. And I think also I'm able to see the impact that my work does. Yeah, I really don't miss or feel regret. But I do remember initially pivoting. It did feel like I was jumping off a cliff. Like, where am I going to land? But I do think yeah, I think there's value in being brave with your life. And I think there's value in choosing yourself and alignment, even in the career context. People talk about it in relationship terms, but even in career, choose yourself, find alignment. Is this serving me? Does this feel like it connects with the journey that I've walked? And I think if you're always using that as your North Star, like you'll always be where you're supposed to be.
Oh, that's quite powerful. Talk to me about the feelings that you had. You said that initially when you pivoted, you felt like you were jumping off of a cliff. How did you manage with those emotions, and how did your support system carry you through that time?
Sure. Yeah, it was a scary feeling because I think there was no clear destination in mind. I didn't know exactly where I was going with this, but I will say, like, as much as the pull factors, if I can call them, of trying to find what I wanted to do, what, aligned with me, they were also push factors. Clinical medicine, I found number one, there were no jobs and job stability and security was way different than what it had been maybe 10 years ago. Way clinical work is structured is very like hierarchical, almost militaristic. The hours that we work, overtime. And I think I also felt like this way of living has actually impacted like my mental health, my way of being. Like, am I going to be able to sustain this for another 4 years, 10 years? is this the life that I want? Also, do I want to have children? Do I want to have a family? I think I'd also reflected on how much time, and I don't mean just time in terms of the length of medicine, but the studying is very demanding. The work, you work weekends, you work over hours. And that takes you away from a lot of life as well. And yeah, I was also thinking about like now moving forward, am I willing to continue to sacrifice more time and for what? Yeah. And I think some of my family members didn't get it, but I think my parents were quite supportive as well because they, in their own careers, had walked different paths. And so I think they had an appreciation that, like, look, you must follow what feels right. And so they were supportive. But yeah, it was scary. I think even moving into this new job, not knowing what is the expectation. We're not on a ward round in the morning. We're not doing ward work. We're not doing anything. It's very different. It's like I'm in meetings, I'm on Teams calls, I'm doing budgets, I'm doing recruitment, like very different. But yeah, I had an openness to learn. So that has helped me to pivot, I think.
I love how you mentioned that your parents had also done their own journeys in their careers of trying different things. I think it's very important to see that in others and also to take it on and reflect it in your own journey. And it's something us in medicine, we haven't seen a lot of it, but I am confident that our generation and by us speaking more about this, we will normalize it.
Yeah, no, I agree. And I think also we have to have an appreciation that like the world is changing, like times are changing and jobs are changing, and not just jobs in medical, jobs across sectors are changing and are gonna change drastically. And that has been happening in medicine, maybe at a more incremental pace, but it's happening in this field as well. And so I do think people that are thinking about their careers in medicine in a more expansive ways are gonna be, I think, more successful in the long term. Not to say that the traditional path will ever disappear, I don't think, but yeah, I think it's changing. And I do think people that are early adopters of change reap the rewards down the line.
Definitely. It's like with evolution. It's you adapt or
Yeah.
you die. Coming into your current role as the innovation director at DG Murray, that sounds so big. If you were to break it down, what do you actually do?
So what do I do? So DGMT, it stands for the Douglas Murray Trust, which is a non-profit organization. And what they do is they make grants to smaller nonprofits. And really, our strategic areas of interest at DGMT are three things. The first is early childhood. How can we enable development of children and their thriving? The second is connecting young people to opportunities in light of the unemployment crisis that we have in South Africa. And then the third, which is my portfolio, is around inclusivity. How do we bring people that have been, you know, relegated to the peripheries of societies, whether it's based on race, gender, ability, sexual orientation? How do we connect them to mainstream opportunities so that they can live thriving lives in society? And so it's a big role. And I think a lot of people, maybe when they think of nonprofits in their minds, you're thinking of a small organization, helping children or women's shelters. But what I have come to learn is that the nonprofit space or civil society space is like a third sector. So the first and second being the public sector and the private sector. There are large organizations that carry huge grants of millions rands of worth of grants to implement projects. And it's not just to close the gap, to fill if people are struggling from poverty. It's really big societal questions around how does society develop? How do we influence behavior change at a grand scale, whether it's around masculinities? How do we put South Africa on a different path in 10 years than where we are now? And those are really big considerations. And it's evidence-based stuff. That's when a lot of research happens, a lot of collaborating within South Africa and internationally. around what the best practices are. And then the idea is that we use these monies that we're able to get through philanthropy or, donations or whatever, and then make those strategic investments that puts the country on a more fruitful path. For me, coming into this space, I think in medicine and in many jobs, like it's very kind of didactic of like, okay, you need to do you see these patients? Go to clinics, see this number, support this many number of surgeries. And like, that's the work that you do. But this kind of work from the jump, it requires creativity because they don't really tell you, yes, they have a strategy in mind, but you have to come with your creativity of like, okay, GBV, like, what do you think? Like, what do you think are, useful interventions? Like, what would you do? And then you begin to talk to other organizations and then find what you think is the best way forward. And then there's capital then to back those initiatives of, how to counter the societal issue, which is, it's big, but I think it's fun because there's a creativity piece. There is an openness of creating a project, a question, an initiative, and then seeing that through. Which is, it's tough, but I think it's meaningful. And then you see the impact that it has on people's lives. Yeah.
At the end of the day, we're all just living to make an impact. And I think that's very important when you look at what it is that you're doing. I don't think it's necessarily important to look at the title, but what impact are you doing? With regards to the civil sector, I've never really thought that doctors can make change in there, but you have really opened my eyes towards that. What skills do you think you've taken from like clinical medicine that you've been able to apply in this sector that you've really seen momentum move in your path with?
Sure. I think maybe even before answering the question, just to say, I was very much the same. I didn't know that doctors could go into civil society sector. But when I started my first job with DGMT, met who's the current CEO, David Harrison, who is also a doctor. And maybe if I can roughly give his background, because he has been instrumental in helping me sort of shape my path. And so he was also a doctor when he finished community service, interested, I think, in pediatrics. But this was around the time of like 93, 94, when South Africa was becoming a democracy. And so he met with people, and at the time the government was trying to find its feet, and then him and a group of young doctors somehow found themselves in rooms with like your Nelson Mandelas, and they were like, okay, you guys are young doctors, like how would you fix the health system so that it could accommodate all the majority and not just a minority. And so they were like fresh conserves that had to grapple with that. And they created the Health Systems Trust, which still stands today, which helped to basically design the current structure of our health system. And so fast forward, he's headed up Love Life before coming to DGMT. But just so to say that I think meeting him has been transformational because number one, he was also a young doctor with, certain plans in mind about his career. But then, another opportunity presented itself to make a huge difference. And that's then the journey that he's walked. And so for me, it's been great to have that kind of a model and mentor in him. And so I think he is definitely someone who sees that doctors have a role to play, not just in the private sector or public sector, but in figuring out solutions for our country's good. And I think that's why I think I am at DGMT and I've stayed because of that ethos. But just thinking about the skills transfer, it's interesting because I think there is a lot of transferable skills from sort of traditional doctor work. I think if you really could distill what we do as doctors every day is problem solving. People come in with a problem and we investigate by asking questions. We investigate through technology. We do x-rays, we take bloods, and then we find a rationale, based off of our knowledge and, what the best practice is to say, okay, this is the differential diagnosis, the list of things that could be possible, and then we treat. So fundamentally, that's problem solving. And so I think that's why our skills are transferable, not just to civil society. I know a lot of doctors who have gone into consulting, and really the work is of a problem is put in front of you, and it's about asking questions, talking to the right people, finding out what the literature is, what the best evidence is, and then formulating solutions. And also, like being a doctor, it's a differential diagnosis to say this is the list of things, and the top is the highest probability, and then this is how we treat according to that. And I think I apply that every day, and I think a lot of doctors that work in consulting, in the pharmaceutical industry also apply that. But I think maybe also there are some soft skills that maybe are not necessarily as valued in medicine, like communication, being able to articulate yourself, ideas. Those things have huge currency in other sectors. Like consulting, basically all they do is like presentations and pitch decks, and maybe in medicine we do that maybe once, and but like it's a very valuable skill. And also having the ability to take in a broad range of information that's new, we do that all the time. If you're a doctor that is keeping up to date, you're reading articles, you are on social media keeping up to date, and we distilling that information all the time. And that is a skill that I don't think a lot of other people have, and is very useful. And so what I think, yeah, and then also there is leadership and, managing crises. Those are hugely valuable. And I think it is maybe managing difficult situations or crises is huge in other sectors, because I think for me it's been tough, but nothing has ever been like somebody is crashing, their sats are dipping and their blood pressure's going down, like life and death. And so I'm like,
Mm.
guys, it's hard, but we go through difficult things
We've
as
been through the
doctors. And so
most.
we're, I think, able to navigate. We've been through the most. And so we can really navigate these like corporate crises with a degree of calm. Like, okay, like, let's solve. Like, what are the steps we need to do? Like, be calm, and also know that they yeah, we can make mistakes and recover and learn from them. Yeah. And I think that those are skills that I think sometimes doctors don't think we have, or don't necessarily use in a valuable sense in traditional medicine, but in other sectors, they are hugely valuable, and people pay a lot of money to upskill in those areas, and they use it in those sectors.
Wow. I truly appreciate how you broke down translating what we do in clinical medicine into what happens in corporate. The whole thing about problem solving and investigating. I've never looked at it from that perspective, but that is truly what we have been trained to do. But if you remove a patient, it feels like, no, unless I, as a doctor, am in front of a patient, what is it that I'm doing? And I wish that we would look more towards the job in clinical as not necessarily saving the life, but like we are investigating, we are solving for a specific thing, we're diagnosing, and diagnosing is actually problem solving, and look at like completely break it down so that you understand what you've actually gained in the journey. You touched upon leadership. Leadership has been something that I've been thinking a lot about this year. How we as doctors, we are actually not properly trained to lead. Have you felt more supported in corporate with regards to being taught how to lead, or how has your leadership journey changed within corporate?
No, absolutely. I think in medicine, maybe my experience, I went from being in internship with a relative amount of support, and then in ComServe, suddenly you are in charge, and like you must do the recess and tell people what to do. And I think it is quite a jump, and I don't think a lot of us are prepared to take on that level of leadership. I think for myself, in my first year of working in public health, I did recognize that, you know what, this area of leadership is an area I can grow in. And so I then applied to do the Mandela Washington Fellowship, which is essentially a leadership fellowship. And I think I liked it because for me, leadership again it's cross-sectoral and it's a skill that you'll use throughout your life. Yeah, and it was really instrumental. I think I was placed in upstate New York at Syracuse University, and we were at, yeah, the school of like citizenship and leadership, and they like really take you through like an intensive leadership program. First of all, just thinking about your own self, personal development, what you think about leadership, what are your strengths and weaknesses that you can apply to leadership. And then, you grapple with your own country's problems. And then at the fellowship, you are there with other leaders from other African countries. And so you're able to hear what is happening in different African contexts. Yeah. And then, of course, you're in the United States, and they take you through how they grapple with leadership, their history. And I remember they even took us like on an excursion to like the US Senate, and like you meet some leaders in that space. Yeah, I think it really helped me find what my personal brand of leadership is, because I think people can lead in different ways. Yeah, and then I think that helped me then grapple with leadership in my work. And I think one thing I will say about civil society is that projects are really funding based. And so they happen maybe in a 1 to 2 year period, but things happen like at a very fast rate. And so that's why you'll find people kind of like you start entry level and you move up like 6 months, 10 months, you move, now you're the manager, now you're the coordinator, now you're the lead. And yeah, I think that helped me hold that space. And I do also think that in medicine, there is a hierarchical structure. You've got your consultant, your registrar, and so people kind of operate within that power structure. But I remember when I started my job, like the current COO, she was like, here, you need to speak up. You need to be able to disagree. You need to be able to advocate, and like that is gonna mean success or non-success. If you're just quiet and amenable and agreeable and following tasks set in front of you, you'll be fine, but you're not going to thrive. And so that was like a mental shift for me, because not just
Wow.
in medicine, society does like operate in hierarchies, and people don't necessarily want to listen to like young Black women speak with authority on things. And so I think at DGMT, that was the first time I had encountered a space like that where they were like, oh, okay, so do you think this will work? Why are you saying that? And they take that in and change course. So yeah, even just finding your voice after medicine is work. But yeah, like this is our lives. This is the spaces we occupy. This is our country. And like we have ideas and perspectives, and they're looking for that. That's why like a lot of companies, they like innovation, innovation. Innovation is new ideas. And they're looking for that because the ways of doing things don't serve progress. And so yeah, so just that I guess was my journey grappling with leadership. Yeah.
Wow. No, you said so much that I really would like to elaborate and pick upon. I think the first thing being your brand of leadership. I have always thought of myself to be a weaker leader because I am maybe an empath, because I tend to not want to rock the boat too much. I look at other people who lead and they are aggressive with it and they take up space more easily. But when you said you have adapted leadership towards your own brand and your own personality, it feels like you have taken your natural strengths and you have embodied that into the role and then looked at how you can lead from that perspective. So there's actually a lot of different ways to lead, and there's a lot of leaders among us. But I think if we had the proper training, we would be able to execute that more. And that's so encouraging.
Yeah, yeah. And I think maybe traditionally people think like the leader is the person who's the loudest in the room and, ordering everybody to do X, Y, Z, but they are different styles of leadership. And I think the kind of leader that I try to be is somebody that's like embedded with the team and co-create and co-think the ideas. And so I do also come maybe from an empathetic lens, and also maybe not afraid to show vulnerability to say, when I don't know the answer, when I don't have the solution, like what can we do? But I think maybe the greatest lesson for me in leadership is about holding space. I think because I think when you're able to hold space for people and give them room, they usually will come to the fore and open up and thrive. And that's where like ideas and creation happens. And also with organizations are not perfect. They also have their weaknesses. And I think being a leader is also about them coming to the fore to say, hey, I'm seeing this and I think we should do it this way. And I'm going to hold this space for that. I think that's leadership in my sense. But I will also say it hasn't been like a pretty, journey, a fairy tale, so to speak. Like leadership can be hard, like especially in tough times when sometimes people don't agree with you, and sometimes you are the villain in people's narratives. And that is like the reality of like leadership. And I think for me, if I always treat people with respect and honesty, and also be clear about, hey, this is where things are, this is what we need. But then I also give people freedom to decide, like, okay, how far can they meet me in this moment? And that's like the reality, I think, of leadership. It's not always pretty. It's not always making speeches on podiums. Yeah, it can be tough. It can be tough.
I can only imagine. I can only imagine. With regards to the fellowship opportunity that you had in New York, how did you come about? How did you find it? How did you decide that it was for you? And how was the application process for that?
Sure. So I think a lot of my opportunities, like I just want to maybe be open to people that these fellowships, these Male and Guardian Awards, like you apply, you self-nominate. Like they don't come and find you in the crowd. And people don't know that. They think like, oh, like it's a Grammy Award. Like, but even Grammy Awards, you apply. You have to submit your music. They don't just be like, greatest track. And so for the
Yeah.
fellowship, yeah, I knew someone that had gone through it, and I contacted them, and I was like, and I think she was a dentist that did it. And I was like, oh, that's so interesting. Like, why is this dentist going on this leadership program? And I was like, oh, that's so interesting. We had a conversation about it, and she was interested in going into business and leading her own business. And I was like, that's fantastic. And I was like, I think I can actually apply this in my context. So I applied. And I told the story of working in medicine. Another thing about doctors is what we don't realize is being a doctor holds a lot of like societal value. People see doctors as really making an impact. And I know sometimes we get caught up in our day to day of, oh, I'm in a ward round, I'm in theater. But like we are actually saving lives, and we're working in a very complex system and huge challenges on the department side and making things work. Essentially, what I did in my application was I relayed my story of working in internship and ComServe and COVID and how it impacted my life and my thinking, and basically letting them know that, hey, I'm wanting to now go into public health, and I could use these leadership skills to, do that successfully. And yeah, that's how I got the fellowship. And even with the Mail and Guardian, I think with all these things, and these are just two things, like there are other opportunities I've applied for that I didn't get, but I think the idea is that I was also cognizant that of the fact that, hey, I may not be doing my primaries or doing like my diplomas, but I have to continuously still upskill. I need to keep my CV fresh and relevant for the path that I'm wanting to take. And there are different opportunities that you can do to do that. And so that's why I was applying for things and opportunities and fellowships and courses, and so that I could continuously build myself for this path. Yeah.
Skilling in the clinical perspective, it's always doing courses and going to like a basic surgical skills thing. But I don't think I've ever thought about how upskilling looks like if you want to go the civil society route or like the non-clinical route. So yeah, that's quite interesting to hear. Quite interesting.
Yeah. And to be honest, like the upskilling in medicine is expensive. These courses are like if somebody needs to do a study of like just how much of our income as doctors is going to upskilling and how that is even impacting our quality of lives. Because these things even expire after sometimes. And so we're in this loop of trying to hold on. And I
It's
think for
traumatic.
me as well, it's like, it is. It is. And to be honest, I think also for me, going into public health is also about like personal freedom and agency over my life. Yes, I still have to pay for some courses and things, but they like the fellowship was free. Like they funded the whole thing. They flew me out to New York, flew me to Washington, flew me back, upskilled me, and it's a great thing I have on my CV. And I know there are many other fellowship opportunities in other countries in South Africa. There are other courses that are available. And I'm just like, I think for me, I also just wanted to, have some agency and freedom from these financial burdens of this course roller coaster.
No, and it makes for an interesting story at the end of the day. It really does. With the whole traveling and just go and apply for a fellowship that is all expense paid and live the adventure.
Yeah, yeah. And I think for me, I like traveling. It's a personal interest of mine. I like immersing myself in other cultures and having experiences. I think for me, even being in med school, and I know there were some people in med school who were able to travel and date and live very full lives. But I think for a lot of people, other areas of your life are kind of on pause for a while. And I think me having reached the end of concept, I was also very intentional about like, I want to live, like, I want to date, I want to travel, I want to have experiences, human experiences. I want to change my mind about religion and spirituality and art and develop a taste for foods. And you can only do that by like really living. And this is having an embodiment outside of your career. So not just being doctor, whoever, it's you're a traveler, you're a girl, you're a lover, you're an artist. And I think that's an important part of life because I think for a lot of doctors, we really let parts of ourselves die. And I think life is about being fulfilled in a holistic way.
You actually touched on something so deep, how we as doctors, we sacrifice or we put our whole life on pause in order to attain the degree. For
Yeah,
5, 6, 7 years, however long you spend in med school, and then the 3 years
yeah,
after, you are chasing finally being a general independent practitioner. And to what cost? To the cost of the development in your whole life basically being stunted. So we're
yeah,
kind of playing catch up now.
yeah. That's why you find a lot of doctors who actually haven't dated before, and not because they're not like attractive or they're not interested, but it's also because you haven't been out there enough. You haven't even
Mm.
developed what is your taste, what are the qualities you like. And you're right, it's almost like we start in almost our 30s where people were at 21, which is
Mm.
yeah, yeah.
It's like we're late blooming with life. We're late bloomers in life.
Late blooming with life. And I think it's okay to late bloom. And I think it is okay to invest that time. But it's like, how much more time? Now you're going to spend another 10 years doing your primaries and red time and wake up at 45, 40 or 35. And then you're going to start going to the club then. Then you're going to take your trip. I think there's lots of opportunities and lots of life that will have passed you by at that.
It reminds me of a quote I saw on TikTok. It said, "Don't let life pass you by while you're trying to get all your ducks in the row." So you're constantly focused on doing the correct thing, that life happens and life eventually just goes away, because there's so much life to have now, and whatever messiness you're in, whatever middle you're in, whatever figuring out you're able to do, don't deny yourself of the pleasures or of the trip or of the Mjolo experience or whatever it is that presents itself when you are not completely ready. Because, I mean, it could make a good story at the end of the day.
Yeah. And I think that story is our lives. Like, and I think maybe medicine has this bigness that it becomes the center. And I think I even see it with people that want to be doctors and didn't get the opportunity to go to med school and want to still do it. Or it's really, it's big, but I don't think it has to be that big. I think it is important work that we do, but it's a job. It's a job. You go in, you clock out, you get paid, and you must still be a human that is happy with themselves, that is able to form meaningful connections, because that's what life is about, actually.
I think the problem lies when people take the job and they make it their identity. How have you been able to separate yourself, have your identity not be glued to the job?
Right. No, I think it's a deeply, like, it's a psychological thing. Like, I think even at work, where I work, people don't call me Dr. Busi or Dr. Kabane-Bailey. They just call me Busi. Even though I am a doctor, I'll always be one, even if HPCSA or whatever. Like, I think there's a level of detachment I have to it. Like, I hold it, but I hold it very loosely. Um, yeah. And I would encourage people to do the same. And I think even if you become a specialist, and I think that's fantastic work, I think you're still a human. You should give and receive love and respect, and you should have experiences that fill your life that are beyond what you do for work.
I think it also just speaks to the self development that you need to have within yourself as a person first. I think life is a lot more better when we look at it from the lens of we are people first and we need to fill that cup.
Yeah, yeah, yeah.
What practical steps would you give towards a young medical doctor who is trying to find their way in what medicine has become in today's day and age with regards to, we're very aware of burnout, we're very aware of the identity struggles, and we're also very aware of the unemployment. And it can cause a lot of anxiety within anyone who's just starting off this career. How would you advise them to look towards the future?
Sure. I would say the first thing is being clear about why it is you studied medicine, and really try to not think about necessarily what you want to specialize in or what course you want to do, but like what is your why? And then the second thing is, like, what kind of life do you want to have? Like, do you wanna have a big life? Do you want to have a small life? Do you want to have a fast paced life? Do you want to have a slower paced life? Do you want to have a connected life with lots of people? And I think that begins to stop the question. And then I think the second thing is you have to connect to other people. And fortunately, we are in the social media age. There are people doing all kinds of things. And a lot of them are on LinkedIn, and you don't have to necessarily be mentored with them or have a long lasting relationship, but really just ask that very simple question of, like, hey, I am at this stage of my medical career, and I think what you do is interesting. Like, how did you get to this point, or what steps can I take? And you'll be able to begin to chart a path for yourself. But also, I think, have curiosity as well. I think, yes, you may have an idea of where you want to go, but I think have a degree of openness. And I think that can be helpful, because I think we're in a situation where you could find yourself unemployed. You could find yourself in a rigid position where you are not necessarily liking it. You could find yourself in public health and be like, actually, I miss clinical. I think, but having openness and curiosity will always give you the permission to take the step. I think maybe there's this idea of the sunk cost fallacy. Like, yes, you spent a lot of time and a lot of money, but there are a million things you can do with this. And in a way that is not throwing this away, it's building on it, it's using these skills. And I also think that people who think openly about their careers will reap the benefits in the long term as well.
That's so beautiful to hear. I think curiosity, they always say curiosity kills the cat, but I think curiosity is the first step towards anything becoming better. And it should be celebrated more.
Yeah, yeah. I think curiosity is key. And maybe with this idea of the jumping off the cliff, there's that quote of, like, what if I fall? But what if you fly? What if you fly?
Exactly. Exactly. I saw a quote that actually said that what did it say? About stop always rehearsing the worst case scenarios because the best outcome also needs your imagination as well.
Yeah, and to be honest, I think maybe because if you were in medical school and in medicine, like you've really been with the people in it, like we are not just one cookie cutter mold of a human. Like they are creative people, they are deeply empathic people, they are people who are super logical, they are people with a hustler entrepreneurial spirit. And I think those things matter. And I think that way of being is what you need to be tuned into to know what it is you want to do next.
It's kind of like you need to know yourself in order to know what alignment for you looks like in the future.
It's true. It's true. And maybe if another practical step, I would say go to therapy, even if you don't have problems. But just unpack like what was happening when you were in matric and you transitioned to this, you know, first year med school class. Like, what was that experience like? What informed it? I think therapy is a great tool to get to the self and understanding who you are and what your values you hold. I think, yeah, then you can figure out the next step.
No, definitely. I truly like that idea. I think there's so many experiences in life that you don't think about because you have suppressed it in order to get moving with the pace that life is at. And sometimes the questions that you ask, the answers lie in those experiences.
Yeah, yeah.
Okay, so to summarize this whole conversation, I think you have definitely touched on so many key points and so many key areas that us as doctors need to think about and think about differently with regards to moving forward. Even just the title of your job, innovation, new ideas, expanding horizons. I think that's definitely the future of healthcare, medicine, our sector especially, and we need to give more time and thoughts into it instead of just doing things the way that they've always been done because people have said so. So I'm really grateful for this conversation. I know I have been impacted and I can only imagine what it's doing for the other person. So thank you. Thank you so much.
I'm glad, and it's a pleasure for me to always share my story. And even if it can just make someone just think in a new way, I think I'm happy with that. Thank you for having me and this opportunity.
Where can the people find you? Are you active on social media? I know you have a LinkedIn, but anything else other than that?
Yeah, so you can find me on LinkedIn and Busi Kabane, and you'll see me connected with DGMT, the Douglas Murray Trust. I think I'm very active there. And I'm also on Instagram, Busi Kabane. You can find me Facebook, and I am keen. I think a lot of people do send me these questions, and I'm happy to answer it. Yeah, because I think part of my journey has been getting help and some advice from people that have helped me craft my path. And I'm always happy to pay that forward.
Definitely, definitely. I think when it comes to networking, people are always afraid to make the first move because you never know how it will be received on the other side.
Yeah, yeah. No, and just ask. And a simple, hey, I'm interested. Like, what can I do? Or what would you advise? And I think I found that people have been more responsive than I had anticipated.
I think people are more open to helping than we would like
Yeah.
sometimes think. I think we think people are way too busy or way too closed off, but a lot of people actually want to help if you will believe that they want to help you.
It's true. And I think sometimes we see people that even that are specializing that get the positions and the jobs and very fast. That's because they're networked. That's because they made relationships in med school. That's because they were forming relationships in internship and bonds with the facilitators, and building enough rapport to create those paths. And so networking is everything. And it feels like it's light, but it's not. It's hugely important, even in medicine. Even in medicine. Yeah.
Definitely. I think some people find it unfair that it's not necessarily the person who knows the most that gets the job, but the person who knows the people. And I think instead of always wishing for the game to be fair and for the game to be ideal, you need to adapt to how it's being played. And networking being on the forefront of somebody's mind, that is what moves the needle in today's day and age. So we need to invest into
Yeah.
it.
And it's so true. And I think with networking, there is also this piece of how power is structured in society that, like, according to race, gender, ethnicity, religion, like, if you are Jewish and you go to synagogue with a consultant, they're most likely to remember you and connect with you and get you that MO post. However, I don't want people who don't necessarily fit into specific molds to fret. I think networking up is great. Try to meet your consultant, your registrars, but also network across. I think we don't necessarily think there's value in your fellow med students, your fellow internship people. Build those relationships, friendships. You don't know where people are going to go, where they're going to end up. I think even for me, when I was doing the Get Ready project, like, I pulled a lot of doctors up in there. And I didn't know I was going to be in that situation. And I was just a young post-conserve doctor. And so if you have not been able to make those relationships with professors and consultants, don't fret. Start where you are. Start with who's in your class, who's in your cohort, who's in your group, and build from there.
No, that's a good starting position. And I think also, just to add on to that, start in the places where you are already in. Like if you gym, start there. Speak to the people
Yeah.
in the gym. If you play
Yeah.
whatever sport, speak to the people
Yeah.
there. You never know what can happen in that space. I think even for myself, just a small
Yeah.
testimony, I had someone in my gym actually recommended me for a position, for a GP locum position, because I was in the gym talking. So you need to be talking.
Yeah. You need to be talking, guys. You need to be talking. And to be honest, I even think this platform that you're creating is great and it's an innovation. There are doctors who are thinking, they're starting telemedicine practices, they're going into podcasts, they're on social media, they're on radio. People are innovating, and that's fantastic. And so if you do find yourself maybe feeling stuck, maybe with limited options, sometimes get on social media. Be seen, be heard. Go out to your community, go to the shelter and be like, hey, I'm a doctor. I want to volunteer. You have value, you have skills. And maybe in these sort of difficult times, it's just about rethinking where you can plug yourself in.
Definitely, definitely. I like how when you were describing about applying for the fellowships and all, you spoke about nominating yourself, that nobody finds you as you are silent. You kind of need to advocate for why you belong in that position. It also reminds me of how, on social media, everybody wants a man, but nobody wants to go outside. People want God to drop the man in their house and whatnot. And nothing in life works like that. If you cannot speak for yourself, you genuinely do not get seen or get a seat at the table or make anything. And it sounds very scary if you're an introvert, but unfortunately, it's how the game is played.
Yeah. It's how the game is played.
Yeah,
Yeah, it's tough, but you have to be seen. You have to be heard. They have to know you're in the room so that things can happen for you. And look, you're a doctor. You have something in your hand. You just need to plug it in to a source and see where it leads.
definitely, most definitely. Thank you so much for this conversation. I feel like we could have spoken for hours on so many points.
Yeah,
Thank you.
yeah. Well, I enjoyed this too. Thank you so much.
Okay, so just to close off the episode, my name is Dr. Diane, and this has been Redoctoring. Please do like, comment, and subscribe. Share this to anyone who you think would benefit from this episode, and I will see you next week. Remember, this is your permission to be a different kind of doctor. Bye.